Hey guys, my name is Mavi, and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors, and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? I am super excited to have with me Dr. Chet Mays, a board certified plastic surgeon out of Louisville, Kentucky. Hi, Dr. Mays.
Hey there. I love the way you said that. Everyone mispronounces Louisville, or we call it Louisville here. So that was
Oh,
good. That was good for a Texas girl. I like that.
thank you. Thank you. It's the twang in my accent that got it. I'm super excited to have you on the show today. And the topic of our episode is something so juicy. I'm sure you talk about it every day in your practice, and that is combination procedures. Combination surgery, multiple procedures done at once. And I know that you are a huge fan of drastic transformation. So I thought you'd be the best guest to really dive into the pros and cons of having multiple procedures and kind of giving us a rundown. Tell us everything you know, what you see in your clinic, what you're seeing on the day to day. My girls love to hear it. So, the first question I'd like to ask is, how do you achieve dramatic results?
Yeah, so I'm a board certified plastic surgeon here in Louisville, Kentucky, and everything I do is elective. It's cosmetic. So anytime we're having that consultation with a patient, it's always listening to them and sort of getting sort of what their goals are. And, shaping and sculpting the bodies is something I do on a daily basis. We sort of talked off screen before about it's rare that someone just comes in for the breast augmentation. It's the breast augmentation with the tummy tuck, with the lipo, sculpting either the lower body, upper body. But those drastic results as a plastic surgeon is that on the table result. I mean, I see it right before my eyes. I call my operating room the art studio. I come from a family of surgeons. All my father, brothers were all general surgeons, but I was more the artist in the family. So I chose plastic surgery because it was more art than medicine. So I actually call the operating room here the art studio, and that's where you just see that drastic transformation on the table, and you give it a thumbs up, a high five to the team, and then they leave, and then they got to recover. It's a recovery. Everything, especially if you're doing multiple areas on the body, it's a big recovery. I always say surgery's the easy part, right? I can do those snatched waistlines, I can do those Brazilian butt lifts, but it's a recovery. It's downtime for patients, and that's one thing we spend a lot of time coaching our patients on, is just knowing that there is a recovery with that. But when I get that tummy tight and that waistline cinched in with the plication, just to look down and see it, it's a very gratifying thing for me to see that on the table drastic result. I just love it.
Imagine how the patient feels
Yeah.
being able to look down and see everything there and not a flap that they were used to having or skin that used to hang there and bother them. As the patient, imagine how she feels when you do that for her. Snatch her up, leaving her feeling and looking like she did maybe pre babies or pre weight loss, and that newfound confidence that our patients and our clients find. It's so good, so good. These drastic transformations are my favorite.
Yeah.
So with that, let's go into what are some of the most popular procedures being done together.
Yeah, so you always hear about the mommy makeover, and a lot of the patients I see are people who've had children. So I always say, oh, anything you do on a mommy is a mommy makeover. But probably the two most common thing in that procedure is a breast procedure with the abdominal procedure. And whether that's a breast augmentation, maybe adding an implant, or sometimes we add other things with our implants called a composite breast augmentation, where you add fat with your implant. That just really gives an extra touch to that breast augmentation. Or if you've breastfed, so now the breasts have lost that volume, they're not where they were. Or maybe they remember themselves when they were breastfeeding, they were engorged, had those full breasts, and now they're coming in maybe trying to achieve that look. So doing that breast lift with that implant, or a breast lift without an implant, or maybe someone who's had large, heavy breast over time. I see a lot of younger patients who are athletic. I have a lot of professional athletes who come in and their breast actually gets in the way of their performance. So we'll do breast reductions, and then we'll do that tummy procedure with those moms, specifically the muscle laxity that you get after childbirth, especially a C-section where they sort of pull those muscles apart to get the baby out. They don't necessarily always put them back together. So a lot of women come in with a lot of loss of tone in their lower abdomen, maybe lower back pain because their core is thrown off. So most people don't know, but a tummy tuck is actually a functional procedure for a lot of these patients, getting their core back, get that core strength back. But probably most commonly is the breast with the abdomen. But I do all kinds of procedures on moms, from vaginal rejuvenation, maybe after a vaginal birth, which we don't talk as much about that. But that's very, very popular, is doing vaginal rejuvenation, whether it's a labiaplasty or maybe vaginal tightening. Those are very popular procedures to do that we don't really talk about during the mommy maker. It's like, oh, I got my breasts and my belly done, but no one's going to say, oh, I had my vagina done too at the same time, because that's something that's not as well talked about. But those are probably the two most common things, are the breasts and the belly. But I like to look at the body. I mentioned artistry. I look at the body sort of 360 degrees, because someone might come in complaining about the abdominal area, but I always say, well, what about the back? What do you think of this? Because I really like to shape that 360 degrees, really get that snatched waistline. We made some liposculpting in the back to really make that pop post-operatively.
Do you, this is very common. When I was a coordinator, I would have patients who we would come in and see, and they would get their quote. And because of what their budget was, they would be like, oh, well, maybe can I take this off, or maybe only do this? Do you let patients in your practice take procedures off, or are you like, look, to get the result that you're looking for, these are the procedures that I would have to do?
Oh, for sure, all the time. And people come from all over. Even though I'm in Louisville, Kentucky, I see patients from Florida to New York to LA that come in here. Being sort of the horse capital, bourbon capital of the world, we have a lot of tourism here. And people really talk about destination surgery out of the country, but I actually do a lot of destination surgery right here in the middle of the country. So you don't have to leave. And, being in our certified center, being here with a board certified surgeon, take great care of the patients. But yeah, it's an itemized, we talk about everything. I call it consultation. Get all your questions out. Tell me what's bothering you. I don't like it when someone comes in and looks at me and is like, well, what would you do to me? I'm like, well, what's bothering you? It's not, you're perfect to me. There's nothing. Like, what do you look at on a daily basis? Because everyone who comes in has a story, whether it's, the weight loss they've gone through, or maybe they've had kids and they just see themselves mentally what they were before kids, but when they look in the mirror, they don't see that. So I sit there and listen to them about what are their goals. And I love wish pics. When someone comes in with photos that they like, that really hones me in on what their post-operative goals are. And if there are things that we've talked about in the consultation that will help them achieve those wish pics, I make sure they don't take that off, because I want what they bring me and what they think their expectation is. I want them to have that post-operatively, because it's all about managing expectations. And I tell patients, I see from 18-year-olds up to 85-year-olds. I've done a tummy tuck on an 84-year-old. I say age is just a number. If
What?
you're working out, then fit body, and you're in great shape, I don't care what the age is, as long as you are healthy. So there's never an age cutoff for these elective procedures if you're healthy and able to undergo them. But there are some things that patients can take off if I feel like it's not going to add to that wish pick look. But wish picks are very helpful, because someone might tell me something and I have a mental image, but then when they show me, I'm like, actually, you're
Okay.
telling me this, but you're showing me something else. So those wish pics are very, very important to achieving that result.
I agree with you 100%. I love getting wish pics from the client to see what's in your imagination of what your body could possibly look like.
Yeah.
So, with that, I want to ask this a little more serious question, which is, what are some of the risks of having multiple procedures done at the same time versus not doing them at the same time and having them only one at a time?
Correct. There, as a board certified plastic surgeon working in my private accredited facility, there are standards that I have, and one of those is length of time, 5.5 hours for everything I do. Patients go home that day. I don't have any overnight observation, so it's a time limit, 5.5 hours. I'm 41 years old. I can do a lot of surgery in 5.5 hours on one patient. But when you combine them, it doesn't necessarily add to the complications. They don't add together or cumulative. It's more of each procedure has their own level of complications. But as long as you keep, have a good anesthesia team who's managing their vitals, their fluids, monitoring their urine output, you can keep patients very stable during these longer procedures. It's position changes. My crew is like a pit crew here. We're used to flipping patients on the OR very quickly so we don't cut into their surgical times and go on to the next body area. So it really doesn't add, as long as you keep those time limits in, monitoring your fluid, your blood loss, making sure. And when it comes to liposuction, there's limits on how much you can safely lipo someone in ambulatory. That means going home after surgery. So I follow all those standards as a board certified plastic surgeon because everything I do is elective. You have to make sure that the risk is low enough for the reward.
Absolutely. That is a very good point. So, for my girls listening, write that down. Okay, so let's talk about what procedures are common in the different age ranges. So, start with the 20s. What are your patients coming in that are in their 20s? What are they requesting? And go up until your 60s and 70-year-olds.
Yeah, so like I said, I see patients from 18 to 85 or 90 years old, and they definitely have different things going on. Weight loss is something you see at all ages. So I see 20-year-olds who maybe have lost 100 pounds with all the weight loss medications out there, the shots or the medications patients are taking. I'll see the different changes of the body. And actually, we don't talk much about it, but weight loss actually ages you really quickly. You hear something about the Ozempic face, something like that. You can have someone in
Mm-hmm.
their 20s who maybe lost 100 pounds. They might look in their 40s or 50s. So those are patients I'm consulting about getting that volume back in the face, whether it's non-surgical. So I have a med spa here where we do injectables, the fillers to get the volume back, or in the operating room, I actually transfer fat to the face to give that natural rejuvenation. But the 20 to 30-year-olds, as far as non-surgical, they all love the lip augmentations. I actually do lip procedures, lip lifting procedures. That's very popular in the younger demographic. But if someone's had children, in their early 20s, they're coming in for the same things my 40s and 50s are coming in for that laxity in the breast tissue or laxity in the abdomen. But
Mm-hmm.
those 20-year-olds definitely love the facial rejuvenation that I do. Maybe their eyelids, they want to get some of that skin off, or they've seen something online that they are intrigued about. And I love, there's positives and negatives about the online world. Sometimes you see filtered things that aren't real,
Mm-hmm.
or AI now. AI has really changed the game of what people think's reality. So I do a lot of counseling, a lot of talking to my patients to manage those expectations post-operatively.
And in their 30s, what are they looking
For every
for?
decade, I love it. Yeah, for sure. Yeah,
We're going to go
yeah.
through up until the
All
70s.
right, let's do it. Yeah, so 30-year-olds, it's close to the 20-year-olds that maybe they've had a child now, so they're coming in more of the abdominal area where they have that muscle laxity after having multiple children. And I'm 41, so now we're starting to get into my age range and my social group. So I see a lot of people from, that demographic or my social circles come in who I've met out and want me to do their surgery. But definitely as you start getting into those 30s, it's more of the postpartum or after childbirth issues that we mentioned earlier with the laxity of the breast and the skin of the lower abdomen. And then the 40s,
And in their
oh,
forties.
yeah, you prompt me or I'll just keep going. So 40s, just like the 30s, you can imagine. Now we're starting to see some of those facial aging things now. It's like they'll bring me a picture of them in their 20s and now they've been out in the sun. You have a lot of lakes here in Kentucky, so people are out, they're basking in the sun. So now they're seeing those things that maybe the Botox or the neurotoxins is not helping. And now we're talking about maybe some facial tightening, whether it's non-surgical. I have done facelifts on 40-year-olds because it's one of those things where what's bothering you in the moment. There's no age cutoff. Someone will come in and be like, well, I'm not 50 yet, so I'm not ready for that facelift. I'm like, well, what's bothering you? And they'll show some neck laxity or facial laxity. It's like, well, that's a facelift. We need to go in and tighten everything up. But definitely the 30s and 40s are more the postpartum, but now we're starting to get some facial aging as we go into the 40s. And now we've hit the 50s. So the 50s is a lot of facial, sort of getting them back, bringing pictures of when they're in their 20s and 30s, and now they want to look and like I said, mentally we see ourselves as something different. Then we look in the mirror and we're like, no, that's not what I thought I looked like. So we do a lot of that when we get in our 50s, the facial rejuvenation from the blepharoplasties or eyelid surgery to the facelifts, to the contouring of the jawline, neckline. All those things are very popular as we get in the 50s. And then up into the 60s, same thing. It's a lot of facial work. But I always say there's no cutoff for that abdominoplasty. I do them on 20-year-olds all the way up to 85-year-olds. Everybody wants a snatch waistline at some point, and I'm happy to give it to them whenever they want to take that under.
And isn't it amazing when you see maybe a grandma, what would be considered
Hmm.
a grandma, somebody in their 60s or 70s? I've seen a 70-year-old grandma have a mommy
Oh yeah,
makeover and look better than a 50-year-old.
yeah. Yeah, on my social media, every now and then I'll just show different ages and have people guess the age of the patients. And I've shown a 75-year-old tummy tuck. I've shown an 84-year-old breast, patients who just, they've wanted something for so long. And I love hearing those stories about, they've waited so long for this, and now that, they've saved up the money and now they're doing it. And just to see them so happy afterwards is what makes that artistry of plastic surgery so great.
Wonderful. It's part of why I do everything that I do, why Big Butts No Lies exists, to help encourage and educate women who are considering having any type of plastic surgery procedure, doing it
Yeah.
right, because you know, and I know that it's very important why we keep saying board certified
Mhm.
plastic surgeon.
Yeah. And that's why I like
So
what you do
why
because
don't you
yeah.
tell us why?
Yeah, yeah, I follow your podcast. I love it. I love all the material you guys put out, because you do take that into consideration. Not all plastic surgeons are created equally, and there's a lot of misconceptions or a lot of, I wouldn't call them lies, I would just say misinformation. Someone might call themselves a plastic surgeon, but you dive deep into their credentials, you're like, oh, I see you were ENT, but you did 1 year of a cosmetic fellowship, but now you're calling yourself a plastic surgeon. A true plastic surgeon is someone who obviously did medical school to become a doctor, and then they went to a residency. The way I did it was it's called integrated. I knew I wanted to be a plastic surgeon as a medical student, so I applied to what's called integrated. So I did 6 years of dedicated plastic surgery training. Another way to do it is maybe 5 years of general surgery or another type of surgery, and then you do a 3 year fellowship. And those are the two ways to become board certified plastic surgeon. But just because you do that training doesn't mean you're board certified. Now you have to take the exams, you have to study for those exams. It's a written exam, so there's a lot of hard questions that you have to study for. And then it's an oral exam. So you basically go out to Arizona and sit down with plastic surgeons who are board certified in a hotel room for all day, and they just grill you on everything you would ever see as a plastic surgeon to make sure that you are safe and competent to have that board certification. And once you do the written, pass it, the oral, you pass it. You actually have to submit your cases. The first year I was in a plastic surgeon, it's called board eligible. That means you're collecting data, your photographs of everything from how long it took you to do a tummy tuck to what was the urine output to the blood loss, all those things they want to know to make sure you're doing things safely before they give you that board certification. So it's a long process, and it shows when you see someone that says board certified plastic surgeon, it has to say plastic surgeon. They can be board certified in something else. They can be a family doctor who's board certified as a family doctor, but they're not board certified in family or not board certified in plastic surgery. You have to, sometimes it's hidden in their credentials. So you really got to look for that. And that's one thing that you
Mhm.
do a lot of education about. And I appreciate that. And that's why I support you. And I wanted to come on here and sort of help with that message because we're all not created equally. And your listeners need to do that research because there are different safety standards for sure.
Absolutely. Thank you so much for all of your support. I do it with so much love for my girls. I do it with so much love for our community. I know the transformation that my surgery helped me, and I've seen it through my patient coordinator career before the show. I would see it in person, the transformations in my patients that I would help through their surgeries. So that's my motivation. I know how it helped me, and I want to be able to help as many women as possible feel how I feel after my surgery.
Yeah, like I said, everyone comes in with a story, and I love hearing those stories, and I love being a part of the process because we celebrate that result together. Maybe not on day one when they feel beat up and hating me because of what just happened, but by that 4 to 6 week mark after their recovery, they're celebrating, they're seeing the results. And it's really that 6 month, I do 6 month before and after photos. We'll snap those photos. And that's when they're like, oh, okay, now I get it. Now I see it. And hearing the sort of the end of their story. And then I always talk about diet and exercise with everything we do. With those medications, if you're not doing those diet and exercises things, plastic surgery is not an excuse for not taking care of yourself. So I've spent a lot of time counseling on health, maintaining the result. I don't want you to look good, just for 6 months. I want you to look good for the next, 16, 20, 30 plus years. And it comes from maintaining that result with a healthy lifestyle.
Absolutely. I'm so glad you touched on that. A new segment that I'm having on the show is I'm going to be asking my surgeons who come on, what are you doing for your scars? How are you treating your scars?
Yeah, it's people have this misconception that plastic surgeons don't cause scars. Oh no, anytime you cut on the body, there will be a scar. Now we're trained how to hide them in the natural lines of the body. And yeah, I could line up 10 patients. I did the exact same surgery. I'd close them the exact same way. And they're going to have 10 different scars because a lot of genetics, environmental factors play into that. But there are some scientific things out there that can help. One of those are scar creams. I always call it levels of scar therapy. The baseline level is a scar cream. So whatever surgery you've had, whether it's a mole removal or a tummy tuck, make sure that 2 week mark you start putting on a scar cream. Those scar creams are great at sort of minimizing the redness, helping you get the best scar. And then the step up from the scar cream is like silicone taping. So the taping with the silicone takes tension off the scar, because one way you get a bad scar, so if you see people who maybe had knee surgery or shoulder surgery, they have really bad scars. It's not because the surgeon was a bad closure. It was because that's a tension area. There's a lot of tension on that scar. It stretches the scar over time. So as a plastic surgeon, I try and put my scars in non-tension areas to give them the best chance. And then above the tape, so we talk about silicone taping. The next step is laser therapy. So maybe getting some laser therapy, breaking down the collagen that builds up to help it sort of become in line. Because as scars form, they're all mixed up. The collagen level, the layers are just like a spider web. As it matures, it becomes sort of straight lines, and that's how the scars over time become nice scars. So there are lasers out there that you can hit with these scars, and it'll help that collagen just really smooth out. So we use a lot of that in the med spa. Patients will come in and they want to do everything for their scars. Like, okay, we're going to start with the scar cream. Now we're going to go to taping. And then around 3 months, we're going to start hitting it with a laser upstairs, and we're going to get you the best scar possible. Because what I don't want is at 12 months when I see them to look at their scars and have an awful scar. I was like, well, what'd you do for the scar? And they're like, nothing. I was like, well, we should have been doing these things to give you the best chance of having that best scar. And every now and then you do all those things and they still have a bad scar. So you do something called a scar revision where you go in and redo the scar. And a lot of times you get a much better scar now that you've sort of let the patient heal and go in and do that secondary procedure. So I never worry about scars. I tell patients, especially a tummy tuck, it's a long scar. I keep it low, hidden in the bikini line, underwear line, so it's not going to pop up when you're out doing your recreational activity. But every now and then you'll just see a scar, be like, oh my gosh, let's do something about that. And so it's nice to have that technology where you can give them the best scar possible.
I love it. I love it. So, before I let you go, I always like to ask my surgeons, if you were talking to one of your best friends, maybe your mom, your sister, somebody very close to you, and they tell you that they're considering having a plastic surgery procedure, what's one tip that you would give them before they go off on their journey?
Yeah, I mean, we've already talked about one of them. It's that certification. So no matter what you're going to see a doctor for, make sure they're board certified in what you're seeing them for. So when it comes to plastic surgery, if it's not a board certified plastic surgeon, just go and find them. Start there. Start your Google search with the board certified plastic surgeons. And actually, as a plastic surgeon, I mentioned it's body art. Everyone operates is healthy. I do plastic surgery on family, on friends, which you might find controversial in the medical world. They say don't treat family. That's one of the codes as a doctor, but it's all art. It's all body art. I've actually done surgery on my sister. I've done surgery on my wife because I feel like I have the talents to give them the safest and best result. and it's all body art and safety to me.
I love it. That was a wonderful tip. And with that, I will let you go back into your clinic. You guys, he took a break from clinic today. He was just in the middle of seeing patients and pre ops, and he took a little break so he could be with us today. But I don't want to hold him up for too long. I really appreciate you being on the show with us and talking about combination surgeries, talking about risks, talking about the decades by ages and what procedures are common in those ages. And with all of that, if my girls want to come see you, how can they get a hold of you?
Yeah, so I mentioned that destination surgery. We love having people from out of town here in Louisville, Kentucky. But you can follow us on all the social media at Dr. Chet Mays or at Mays Plastic Surgery. You can go online to our website to find us, or you can call the office. But Google plastic surgery in Louisville, Kentucky, and you might find some bourbon in there. But hopefully, we pop up for Mays Plastic Surgery.
I love it. Thank you so much for being on the show, Dr. Mays. And with that, you guys, I will see y'all next week.
So, if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.